Hello and welcome to the first video of Mama Flick's pregnancy series. Let me first congratulate you for getting pregnant. It's so exciting, isn't it? Getting ready for this next chapter in your life. In this first video, you will learn about what is happening inside your body in your pregnancy. Pregnancy is a period of considerable changes in a woman's body. These changes, affecting virtually every part of the body, are all geared towards growing and delivering a healthy baby without harming the mother. Some of these physical changes are visible, such as an expanding belly and weight gain, while others are well known, such as an enlarged uterus, morning sickness, and backaches. However, a few bodily changes may be unexpected and catch some women by surprise. Pregnancy lasts an average of 266 days, 38 weeks from the date of conception, or 40 weeks from the first day of the last menstrual period. It is divided into 3 periods of 3 months each. These periods are known as the first, second, and third trimesters. Each trimester comes with its own unique set of experiences. During the first trimester, your body will go through a lot of changes while your baby is developing. As your hormone levels change and your baby starts growing, so will your body. As you progress through the first months of your pregnancy, expect to feel different in many ways. You may be wondering, how does your belly change in the first few months of pregnancy? Well, at this point your baby is still very small. So most of your belly changes come from the weight you gain in your first trimester. Most physicians recommend gaining about 3 to 6 pounds, which is 1.5 to 3.5 kilograms during the first trimester, and eating approximately 150 extra calories a day from healthy sources. You can access simple healthy recipes in the bonus video where we talk about everything you need to know about your diet. Your breasts will change in multiple ways during the first trimester. You can expect some breast tenderness due to the mammary glands enlarging. Your breasts can grow as they begin preparing for breastfeeding. This also occurs from a rise in progesterone and estrogen, the 2 very important hormones. The areolas around your nipples may show changes by becoming darker with larger Montgomery tubercles bumps. Another thing that can happen, your veins can also become more visible. During a woman's first prenatal visit, her pelvis will be examined to decide if it's roomy enough to deliver a baby. But nature has also provided a way to help create more space in and around a woman's pelvis. And that's by secreting pregnancy hormones, including one known as relaxin, to loosen joints and ligaments. Relaxin not only relaxes ligaments in a woman's pelvis to prepare her for labour and delivery, but it also stretches joints and ligaments all over the body. This can lead to back pain and sciatica, or pain along the sciatic nerve, which starts in the lower back and runs through the backside and down the leg. Practicing yoga, especially the cat pose and cow pose, which are both good for lower body discomfort, is highly recommended to deal with this issue. You may have many good hair days during pregnancy, as estrogen increases the length of the growing phase of hair follicles, often resulting in a thicker and healthier looking head of hair. As estrogen levels fall again after giving birth, you may shed more hair. You might see clumps of hair falling out after a shower or brushing, which is a normal occurrence. Most women find their hair returns to its normal growth and texture within 4 to 6 months after giving birth. In addition, fluctuating hormone levels can produce a dark line in the middle of the abdomen, running from the belly button to the pubic bone. Known as Linea Negra, this pigment change is usually more common in women with a dark complexion, and it often fades after delivery. A majority of women will tend to feel warmer and sweat a lot during pregnancy due to an increased metabolic rate and increased sweat gland activity. To stay cool, especially in the summer, it is recommended to wear loose clothing and drink plenty of water and other fluids every day. Fatigue is very common in the first trimester. Don't be surprised if the physical changes in the first trimester cause extreme tiredness, requiring extra rest. Don't worry, these symptoms dissipate in the second trimester for most women. Take naps whenever you can and be sure to get your good night's sleep. Finding a natural rhythm, going to bed at the same time every night, and sleeping the right amount can help you stay healthier and happier during your pregnancy. The increased hormones in your body during pregnancy can also create some digestive problems and heartburn. Nausea is the most common symptom during the first trimester, and it can range from mild nausea to vomiting. You may also experience some constipation, heartburn, and problems digesting food properly. Good advice would be to try eating smaller meals throughout the day and avoiding acidic, spicy, and greasy foods. Like the fatigue experienced in the first trimester, the morning sickness and nausea goes away in the second trimester for most women. Another thing that can happen is increased urination. Though it is more common in the third trimester, it can also occur during your first few months of pregnancy. This is because your growing uterus pushes on your bladder. So don't be surprised if you find yourself using the restroom more often, as your uterus is growing, which puts more and more pressure on your bladder. The lining of the vagina will become thicker and less sensitive. You may notice a thin white discharge. This is normal during pregnancy. Mild spotting and some bleeding is normal in the first trimester, and it occurs in about 1 in every 4 women. It typically isn't a concern unless it is heavy bleeding and accompanies severe cramping. Spotting occurs shortly after the fertilized embryo implants in your uterus. Your hormones are on overload during pregnancy. You might feel moody, forgetful, or unable to focus. Mood changes during pregnancy can be caused by physical stresses, fatigue, changes in your metabolism, or by the hormones called estrogen and progesterone. Significant changes in your hormone levels can affect your level of neurotransmitters, which are brain chemicals that regulate mood. Mood swings are mostly experienced during the first trimester between 6 to 10 weeks, and then again in the third trimester as your body prepares for birth. As your body grows, some areas of skin may become stretched tight. Elastic fibers right beneath the skin may tear. This creates streaks of indented skin called stretch marks. Stretch marks are likely to occur on your belly and breasts. Not every pregnant woman gets stretch marks, but they are very common. Unfortunately, there's no way to prevent them completely. Try to manage your weight and not gain more than what your doctor recommends. We recommend using cocoa butter to help relieve the itchiness of stretch marks. They typically shrink after giving birth and become less noticeable. Hormonal changes slow the flow of urine, and your bladder doesn't empty completely because your enlarged uterus pushes on it. You may develop an infection of the urinary tract. Untreated urinary tract infections can lead to preterm labour, so be sure to tell your doctor if you think you have one. Symptoms include needing to urinate more often, a burning sensation when you urinate, or the presence of blood or a strong odour in your urine. In about 1% of pregnant women, a condition called cholestasis can develop. This is a liver disease that causes intense itchiness, usually starting with the soles of feet and palms of hands, that worsens at night. Call your doctor right away if you experience these symptoms. A pup rash, or in other words, pruritic urticarial papules and plaques of pregnancy rash, is a common skin condition. Natural remedies, including oatmeal, chamomile, and peppermint, can help. It affects about 1 out of 150 births. Itchiness in the abdomen is accompanied by a rash or hives that can radiate to the thighs, buttocks, and back. This condition is not dangerous, but it is uncomfortable. Your healthcare provider can prescribe topical creams to treat the affected areas. The physical changes occurring in your pregnancy may be uncomfortable, but some of them can actually be a good sign that your pregnancy is progressing normally. If you, however, experience any unusual signs or symptoms, be sure to speak with your doctor about it.